I'm not condoning or promoting illegal hallucinogenic substances. I'm simply saying that many anesthesia medications can have psychedelic properties. Let me grab this pulse oximeter so I can show you here. So I have the pulse oximeter on my finger, and you can actually see my pulse on the monitor here. Hi, I'm Dr. Kaveh, and this is a real-life operating room, and I'm going to share with you 3 things that you should not do before surgery if you don't want to torpedo your mental health and wake up with more pain and more surgical complications after. And a lot of these tips actually come from psychedelic medicine treatments, and that's no surprise because a lot of anesthesia medications can also be psychedelics. Number 1, watch out for mantras that you're repeating, especially when you're on the operating room table like this one here. It's actually really comfortable because we don't want you to have any ulcers from being on it for too long when you're under anesthesia. So what is so problematic and potentially dangerous about mantras? If those mantras are negative mantras like, I'm so afraid of pain, I'm so afraid of waking up nauseous after surgery, I'm so afraid of my surgery. When these keep getting repeated in our brains, we begin to believe them, and believing these for days or weeks or months before your surgery actually impacts your physical body to the point where we see it when you're under anesthesia on this bed and connected to the life support monitors like you see behind me. Not only might you need more anesthesia to fall asleep and stay asleep so you don't remember what's going on, but there's also a higher risk of side effects if you're so wound up from repeating the same negative mantras. It's totally normal to be a little anxious or be a little afraid before surgery because there are lots of uncertainties when you're on this operating room table. But if those fears and uncertainties become ingrained in your brain by repeated mantras, they can have a lot of negative effects and can actually increase the risk of depression or rebound depression when you wake up after anesthesia, in addition to increasing the pain and nausea after anesthesia. So if you find yourself in the habit of repeating these phrases to yourself, change the phrase a little bit. Instead of saying, I'm so anxious about my surgery, say, I'm noticing that I'm feeling anxious about my surgery. Huge difference when you disassociate yourself from what you're afraid of and instead notice that it's going on inside of your body instead of repeating that you are that negative emotion. It is so much more powerful to disassociate yourself from that emotion so that you don't identify as that emotion, but rather notice that that emotion is within you, because that's the first step to being able to take control over that emotion and ultimately control your body. Number 2. Your emotions not only influence your breathing, but how you're breathing also influences your emotions. For example, if you're on the operating room table here with me and you're breathing in a panicked way, you may actually induce panic within yourself and increase the risk of complications and waking up with more nausea and more pain. The good news is that if you change your breathing, you can actually change the emotions that are coming up because of your breathing. And we can actually tell what your breathing is like once we connect you to the monitors. Let me grab this pulse oximeter so I can show you here. So I have the pulse oximeter on my finger, and you can actually see my pulse on the monitor here. Based on how your pulse is on the monitor, we can actually tell if you're psyching yourself out and increasing your anxiety and fear, or if you're actually relaxing yourself to decrease your anesthesia requirements and decrease the chance of complications after you wake up. And the best breathing techniques are actually very simple to learn. I've done them in lots of other videos, so you can check them out, but to quickly recap, it's 5 seconds in and 5 seconds out. Anything that helps you breathe out more slowly will probably help relax you as well, and that affects your brain and it affects what happens to your body connected to the ventilator on the operating room table for surgery. And if you want proof, I'll do a quick demo. Check out my pulse here as I breathe in and breathe out, and see if you can figure out when I'm inhaling and when I'm exhaling based on my heart rate alone. I'm inhaling now. Now I'm gonna exhale. Did you guys see how when I inhaled, my heart rate went up, and then when I exhaled, my heart rate went down? So that's also biofeedback, which is another very powerful way to take control of your body before surgery. And number 3, do not beat yourself up in the days, weeks, and months before your surgery. I'm not saying to let yourself go before surgery, but I'm saying that you should not beat yourself up if you catch yourself repeating a negative mantra or breathing in a panicked way, for example. And this is one of the most powerful parts of psychedelic medicine and mindfulness, because the greater we can disassociate ourselves from these negative thoughts like beating ourselves up, the better we are able to escape the clutches of negative mental health conditions like depression, anxiety, chronic pain to an extent, and all these things can get worse after surgery. I'm not condoning or promoting illegal hallucinogenic substances. I'm simply saying that many anesthesia medications can have psychedelic properties, which can be very powerful to heal your body and mind together in stressful scenarios like surgery. And these can be used safely outside of surgery with careful physician monitoring and supervision to make sure that you don't have a bad trip, for example, that might make an already tough situation even worse. But the fact that these 3 tricks can be done with or without psychedelics just shows how much power you have over your health, and it's probably more than you've ever been told. If you're having surgery anytime soon, I'm sending you my positive wishes and positive vibes, and please share this knowledge with loved ones who might be having surgery as well.